Dr. Kruger. Today we're going to be doing my second Hair PRP treatment. When you're new to Hair PRP, you want to start out by doing it once per month for the first 3 months, and then you follow up at 6 and 12 months for best results. We got the blood spinning right now. This is about 4 weeks from my first round of PRP, and so far what I've noticed is the hair that I do have is coming in thicker. I can tell when I'm combing it and parting it, it looks much thicker. And then the other thing I've noticed is less hair loss overall. So it's slowing down that process or helping it. And about 3 to 6 months down the line is when you would start to expect some new hair growth. But the biggest thing with the PRP is just the consistency up front and then supporting the body for the best results. I also stayed really well hydrated today, which was a little bit of an issue on our first round where I didn't have a ton of plasma, but today there was a lot of plasma. I drank about 100 ounces of water prior to the blood draw, so we have a lot of plasma to work with. Also today, we're just going to treat the front of the hairline. Our first round we did about a 4x concentrate of the platelets. Today I'm going to try a stronger concentrate. I'm shooting for about 6 to 7x, and theoretically that should be much stronger with better results. And we do a double spin technique here, a soft spin to separate the plasma initially from the white blood cells and red blood cells, and then a hard second long spin to really concentrate the platelets down to get a higher platelet count. So the blood should be done anytime. In the meantime, when the blood is spinning, we go ahead and numb the scalp and clean the scalp up in preparation for the injections. The injections themselves go fairly fast, maybe 5 to 10 minutes overall. I also went ahead and took 1,500 milligrams of acetaminophen today, just as a general analgesic to kind of just numb the treatment process. That's not always necessary, but what I've noticed, the scalp is a very sensitive area, and so you want to do as much as you can to take the pain down and numb it up. So I like the combination of acetaminophen as well as a topical anesthetic. We usually use lidocaine or BLT cream, and those both seem to work very well. You can also use a freeze spray when you're administering the treatments.